Okay, good afternoon, everyone, and thank you again for joining us for the daily briefing on the City of Philadelphia's response to COVID-19. Speakers, Mayor Kenny, Managing Director Brian Abernathy, and Health Commissioner Dr. Thomas Farley will be joining the briefing virtually to adhere to social distancing guidelines. And we will begin our briefing with opening remarks from Mayor Jim Kenny. Mayor.
Thanks, Mike. Good afternoon, everyone. After a tough end of the week last week, presented a new budget filled with difficult cuts, I'm happy to start this week with better news. We have reached a tentative agreement with the last of our four major municipal unions, District Council 33, for a one-year contract extension. I know this has been a challenging time for all city workers, and I'm grateful to all our employees for their efforts to keep the city running in the midst of this public health and economic crisis. With all four of our municipal unions agreeing to extensions, we can focus on the challenges at hand and give all parties time to determine what makes the most sense for a longer-term deal in light of the unprecedented circumstances we now face. I want to thank Pete Matthews for his leadership and his members for their continued service to the city. I look forward to ratification of this agreement by District Council 33's membership. Today, I also want to remind folks that May is Mental Health Awareness Month, and each year it serves as an important chance to remind everyone of the resources that are available if you or a loved one needs support. The importance of Mental Health Awareness Month has never been greater than this year because of the pandemic. We enter May having endured nearly 2 months of needing to stay home, 2 months of restricted activities and shuttered business operations, 2 months of time physically away from friends and family. For some, this new reality has brought feelings of grief, loss, anxiety, stress, or overwhelming sadness. In the midst of COVID-19, mental well-being is more important than ever. I want to remind Philadelphians that you are not alone and that it's okay to seek help for these and other symptoms. So I am pleased to announce the launch of a new public awareness campaign sponsored by the city and Independence Blue Cross. A campaign called Mindful Together will bring an improved community understanding of mental health and well-being. We want to reduce the stigma associated with needing mental health support, and we will offer vital support needed by those impacted by mental health challenges. The site is a joint effort between the city's Department of Behavioral Health and Intellectual Disability Services and Independence Blue Cross. I again want to thank Dan Hilferty and his team for their important work on this and for their tremendous support of the challenges that this city has faced because of this virus. And I want to thank Visit Philly, Cashman and Associates, and Chatterblast Media, which have also donated time on this important effort. The Mindful Together campaign includes a new, easy-to-use website at mindphltogether.com. The site makes mental health resources more readily available to all Philadelphians. Again, the site is mindphltogether.com. I want to encourage anyone who is feeling the stress of this unprecedented situation or who knows of relatives or friends who are struggling to seek help for themselves and others. Finally, today marks the start of National Travel and Tourism Week across the country. Obviously, the last 2 months have been devastating to Philadelphia's tourism and hospitality business. I am sure they're anxious for the time when the city's great tourist attractions can reopen and when visitors start flocking back to Philly to enjoy our great hotels and restaurants. On a brighter note, today at 4 p.m., Philadelphia will be represented globally during the James Beard Foundation's Awards nominee announcement. The first ever virtual presentation will feature appearances by a handful of Philadelphia award-winning chef talent, along with food and beverage leaders. The event, hosted in partnership with Visit Philadelphia. Philadelphia has 10 James Beard Award semifinalists in the running, with 13 overall in the state of Pennsylvania. The nominee announcement will be made on the board's foundation's Twitter account, @Beard Foundation. So if you're able to watch at 4 p.m., please do. It would be a great way to support our hospitality industry. Now, Dr. Farley, please, with your daily update.
Thank you very much, Mayor. We've been through some tough times with this epidemic, but over the weekend, the situation here in Philadelphia is starting to look better. So here are details on that. We have 186 new cases of the coronavirus infection diagnosed in Philadelphia residents, bringing us to a total of 16,040. Now, many laboratories don't test on Sunday and some don't test on Saturday, so that daily number is artificially low. We expect that number to increase in the next few days. Still, this is now the third day in a row where our daily case count is below 400. And that's despite the fact that we're increasing the number of tests that we're doing. So that clearly is good news. If you want to see the trend, again, look on our website, look at the graph. We're continuing to see clusters in congregate settings, but we are seeing some reductions in the cases in those clusters. The jail cluster, for example, currently we are at 41 inmates who are testing positive. That's 0 new positives since yesterday and 2 people who've recovered since yesterday. In the future, we'll be posting information on the jail cluster on the COVID website. We have unusual news today on the number of deaths that we have to report. We have 0 new confirmed deaths and a total of 726. Now, that 0 new confirmed deaths is in part because we don't have as many laboratory tests reported today. You can't confirm a death if you're not having a laboratory test reported. But the total number is actually 1 less than yesterday, because there was 1 death in the past that was reported and it turned out to be an error. So that's been removed from the total. So the fact that we've gone down 1 is clearly good news. Of the 726 total deaths, we have 385 or 53%, which are nursing home residents. Situation in hospitals is very similar to the way it was before. We have 982 people with the infection in Philadelphia hospitals and 1,807 in the Southeast Philadelphia region, Southeast Pennsylvania region. 28% of our general medical beds and 27% of our intensive care unit beds are available. Those numbers are very similar to where we've been for the last 10 days. And I'm hopeful that's a sign that the surge of patients going to hospitals is behind us. Good news on testing as well. We have 2 new testing sites to announce. Delaware Valley Community Health will be providing testing at their Fairmount Primary Care Center at Girard Medical Center. And Greater Philadelphia Health Action will be providing testing at their Hunting Park location starting May 6th. Both of these sites are by appointment only. If you go to our website, you can see a phone number. You need to call ahead to make an appointment. You know, we are seeing now improvements in the number of materials we have for doing testing and the laboratory capacity to do testing. We are seeing increases in the number of tests that we're doing and our ability to do tests. So because of that, we have limited in the past who we recommend to be tested. We're now expanding those criteria. In the past, we were recommending testing for healthcare workers with symptoms or people over the age of 50 with symptoms. We're now saying that we will offer testing, or the health department is recommending that sites offer testing to anyone with symptoms compatible with the coronavirus infection, regardless of age. Within that, though, we're recommending priority for people who are at higher risk or in higher risk situations. That would include residents and staff at facilities for congregate living, such as homeless shelters. It would include public safety workers, such as police and fire and emergency medical service workers. It would include other essential workers, such as people who work at grocery stores and pharmacies. And it would include contacts to known cases. Someone who's been exposed to someone else that we know has the coronavirus infection. So that's where we are with testing. Now, as you know, there are other parts of the state that are now experiencing a partial reopening after having closed their economy in the past. We certainly here in the Southeast want to reopen as soon as possible. And the way to do that now is to take every action we can take now to maintain the reduction in spread that we've seen so far. That means wearing a mask. Now, we're requiring masks like this for people who are going into grocery stores. But we need to make wearing a mask like this something that is the expectation, something that people wear all the time. So that when you're out all the time, you should wear a mask. If we can get to that stage, then we can gradually open up all of our other activities and do that safely. We won't see an increase in the number of cases. Remember, the general principle is that my mask protects you, your mask protects me. It's an act of common courtesy to wear a mask so you don't expose other people that you may be nearby. If you want more information about the epidemic, go to our site, www.phila.gov/COVID. For medical questions are answered to 1-800-722-7112. Thanks.
Great. Thank you, Dr. Farley. And now Armando will provide the Spanish language translation of Dr. Farley and the mayor's remarks.
Mensaje del alcalde Jim Kenney para el lunes 4 de mayo del 2020. Buenas tardes a todos. Luego de una semana muy difícil en la que el viernes pasado presentamos un nuevo presupuesto lleno de recortes difíciles, estoy feliz de comenzar esta semana con mejores noticias. Hemos llegado a un acuerdo tentativo con el último de nuestros 4 principales sindicatos municipales, el Consejo del Distrito 33, para una extensión de contrato por 1 año. Sé que ha sido un momento de retos para todos los trabajadores de la ciudad y les agradezco a nuestros empleados por sus esfuerzos para mantener a la ciudad funcionando en medio de una crisis económica y de salud pública. Al haber acordado las extensiones de contrato por 1 año con nuestros 4 sindicatos principales, podemos ahora concentrarnos en los desafíos actuales y darle tiempo a todas las partes para lograr un acuerdo más a largo plazo, tomando en cuenta las circunstancias sin precedentes que enfrentamos ahora. Quiero agradecerle a Pete Matthews por su liderazgo y a sus miembros por su servicio continuo a la ciudad. Espero con interés la ratificación de este acuerdo por parte de los miembros del DC-33. Hoy, también quiero recordarles a las personas que mayo es el mes de crear conciencia sobre la salud mental y que cada año sirve como una oportunidad para recordarles a todos sobre los recursos disponibles si usted o un ser querido necesitan apoyo. El mes de la concientización sobre la salud mental este año es particularmente importante debido a la pandemia. Entramos en el mes de mayo después de haber estado casi 2 meses en nuestra casa, respetando la orden de permanencia en el hogar. 2 meses de actividades restringidas y operaciones comerciales suspendidas. 2 meses de estar físicamente lejos de amigos y familiares. Para algunos, esta nueva realidad ha traído sentimientos de dolor, de pérdida, de ansiedad, de estrés o de tristeza abrumadora. En medio del COVID-19, el bienestar mental es más importante que nunca. Quiero recordarles a los habitantes de Filadelfia que no están solos y que está bien buscar ayuda para estos y otros síntomas. Así que me complace anunciar el lanzamiento de una nueva campaña de concientización pública patrocinada por Independence Blue Cross y la ciudad de Filadelfia. La campaña, que se llama Mindful Together, brindará un mejor entendimiento de la salud y el bienestar mental. Nuestro objetivo es reducir el estigma que a veces se asocia con la necesidad de buscar apoyo en materia de salud mental. Vamos a ofrecer el apoyo vital que necesitan los afectados por los problemas de salud mental. El sitio web es un esfuerzo conjunto entre el Departamento de Salud Mental y los servicios de discapacidad intelectual de la ciudad e Independence Blue Cross. Quiero agradecer a Dan Hilferty y a su equipo por su importante trabajo con esto y por su tremendo apoyo a los desafíos que esta ciudad ha enfrentado debido al virus. Quiero agradecer a Visit Philly, Cashman y Associates y a Chatterblast Media, que también han donado de su tiempo para este importante esfuerzo. La campaña Mindful Together incluye un sitio web nuevo y fácil de usar en mindphltogether.com, es decir, mindphltogether.com. La página web concentra en un solo lugar todos los recursos de salud mental disponibles en la ciudad para todos los habitantes de Filadelfia. Nuevamente, el sitio web es mindphltogether.com, que es mindphltogether.com. Quiero alentar a cualquiera que sienta que el estrés de esta situación sin precedentes le está afectando o que sepa de familiares y amigos que están luchando contra las consecuencias del mismo para que busquen ayuda para sí mismos y para los demás. Y finalmente, hoy comienza la Semana Nacional de Viajes y Turismo a nivel nacional. Obviamente, los últimos 2 meses han sido devastadores para las empresas de turismo y hotelería de Filadelfia. Estoy seguro de que esperan con ansias que las grandes atracciones turísticas de la ciudad puedan volver a abrir y que los visitantes comiencen a volver en masa a Filadelfia para disfrutar de nuestros excelentes hoteles y restaurantes. En una nota más brillante, hoy a las 4 de la tarde, Filadelfia estará representada a nivel mundial durante la nominación de los James Beard Foundation Awards. Esta primera presentación virtual contará con las apariciones especiales de chefs galardonados de nuestra ciudad junto con líderes de la industria de alimentos y bebidas. Este evento está organizado en asociación con Visit Philadelphia. Filadelfia tiene 10 semifinalistas en los James Beard Foundation Awards y 13 en total están representando al estado de Pensilvania. El anuncio del candidato se realizará en la cuenta de Twitter de la James Beard Foundation, por lo que si puede sintonizarlo a las 4 de la tarde, hágalo, pues sería una excelente manera de apoyar a nuestra industria hotelera. Y esta es la actualización en materia de salud al lunes 4 de mayo del 2020. Los números del fin de semana han estado mejorando. Desde ayer se han confirmado 186 nuevos casos del coronavirus en Filadelfia y actualmente tenemos un total de 16.040 casos en la ciudad. Muchos laboratorios no realizan pruebas los sábados o los días domingo, por lo que este número puede ser artificialmente bajo. Sin embargo, este es el tercer día seguido en que reportamos menos de 400 casos diarios. No tenemos casos positivos de COVID-19 entre los internos, con un total de 41 casos registrados. 2 internos adicionales se han recuperado ya satisfactoriamente. Y felizmente, hoy no reportamos muerte por la COVID-19 en la ciudad. Hay un total de 726 personas que han muerto por la COVID-19 y 385 o el 53% de estas muertes se han dado en lugares que son hogares para ancianos. El número acumulado disminuyó en 1 desde ayer, pues esta muerte se clasificó como la COVID-19 por error. Hay que recordar que este virus no discrimina por raza o por género. Hay 982 personas que han sido hospitalizadas en Filadelfia y 1.807 personas en la región sureste de Pensilvania. La cantidad de pacientes hospitalizados ha estado dentro del promedio en los últimos 10 días. Un 28% de las camas de hospitales siguen disponibles, así como el 27% de las camas en las unidades de cuidados intensivos. Las pruebas siguen disponibles y hay 2 nuevos centros de pruebas a su disposición en la ciudad. Las pruebas se realizan bajo cita. Por favor, llame a los números indicados en el sitio web fila.gov/COVID-19. Estos sitios son el Delaware County Community Health, Fairmont Primary Care Center en Girard, Greater Philadelphia Health Action en Hunting Park, que comienza a atender el día 6 de mayo. Y también quiero decirles que ha comenzado la reapertura parcial en otras partes del estado. Nosotros queremos reabrir a Filadelfia lo antes posible. La forma de hacerlo es tomando las medidas de prevención para la propagación del virus. Usa la máscara cuando estés fuera de tu casa. Esto es algo absolutamente necesario, porque juntos podemos superar este gran reto. Gracias.
Thank you very much, Armando. And we are now going to move to the Q&A portion for members of the press. And as usual, I would like to ask our speakers today to join us again through their audio and video. Please remember, of course, we have limited time during the briefing, so only one representative from each media outlet is permitted during the first round. Reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. In today, please use the raise your hand feature found under the participants list. And we also ask that you use your video feature if you can while you ask your question. We will now unmute the reporters one by one as you are called on. And first off today is Mitch Blocker of NBC 10.
Thank you, Mike. Good afternoon, all. Dr. Farley, with the picture-perfect weather right now, are you seeing too much crowding in public parks? And I'm wondering how you weigh the pros of being outside versus the cons of possible viral spread.
We've said it's okay for people to go outside and exercise by themselves and then go back inside. I am concerned about people being outside together and not wearing masks. And I recognize that people are so crazy they want to get outside. And so we really want to emphasize now that they need to be wearing masks. If they're outside with other people, there is a risk that they're going to either spread the infection or acquire the infection from others. So I was concerned about the number of people that I saw outside yesterday not wearing masks. We really need to change the way that we behave if we want to ultimately reopen society as we want to.
How long will we have to wear masks?
It's hard to say. Certainly, we know that if we go back to the way we lived before without wearing masks, the virus will absolutely come right back. That most people still are not don't have antibodies, so that they're unprotected from this. So it's going to have to be something that we expect to wear for a long time.
And this may be a question for the mayor or for Brian. Over the weekend, New Jersey had to shut down several beaches from overcrowding. I'm wondering, does Philadelphia have any reason to do that or any plans to do that?
Well, we don't have a beach, obviously, so we don't have to shut that.
Public parks.
This whole comes down to kind of personal responsibility and maturity. I mean, all the video I saw over the weekend on the TV news and my experiencing out with a mask on a bicycle, getting some exercise, is that young people, for some reason or another, refuse to put this mask on. I'm just judge people's age by 30 or under, who are jogging, running, picnicking, playing volleyball, just refuse to wear a mask. And I don't know what the ultimate approach is going to be to that. And granted, the weather gets better and better and people go out. But these young folks don't think of their parents or their grandparents or themselves when they do this. So it's still a conversation we have to have internally, try to figure out what we do to keep this from surging back.
And one last question, sir, regarding economic impact. Temple University has decided not to do employee furloughs, but they are doing a hiring freeze and having some pay cuts. Obviously, Philly's home to a lot of universities that employ a lot of people. I'm curious what kind of impact the decisions that these schools are making have on Philadelphia's economy?
We won't know because it's never happened before. We do have people who can do this kind of look forward as to what we expect in revenue or not expect. I'm concerned also about the way schools are conducted in the future. Will it be more distance learning? Will we have campuses the way we know them? Will we have games at Franklin Field or at the Link with Temple? I don't know the answer to any of these questions. And as we move forward through this, we'll try to adjust and do our best to make everything come out okay.
All right. Thank you, Mitch. Next up, Avi Wolfman Arendt of WHYY. Hold on, Avi. Let me.
Yeah. I'm ready now. So this is just one question, and I think it's for Dr. Farley. The Delaware County Council asked the state to count nursing home cases separately from other types of cases when considering whether or not to reopen different parts of society. Do you think that's epidemiologically sound? Is that something you would like Philadelphia to advocate for as well?
Well, certainly, the majority of our deaths are occurring in nursing homes. Nursing homes are particularly important, and we would want to see a decline in cases in nursing homes and an evidence that we really can protect nursing homes in the future. I wouldn't by that mean that we should take nursing homes out of the equation and only focus on the cases outside of nursing homes. I'm fine with following both, but we need to certainly need to make sure that we have some sense that nursing homes are getting better, as well as a sense that the overall epidemic is getting better.
Thanks.
Okay. Next, we go to Natasha Brown of CBS 3.
Hi, this is just a question in light of the openings on Friday with construction and some of the recreational venues like golf courses and things like that. Just wondering if the mayor or Brian, if he's on the call, could talk to us about what they've heard or seen about those areas and if they seem to be in compliance or what they're seeing so far with that.
I mean, Doctor and Brian can. You can join. OSHA rules and other rules, and layering these rules on top of them, I think would be an additional burden for them. But I think they're more equipped to do that than any other group. As far as the golf courses are concerned, if they follow the rules, one person in a golf cart or walking, I think the masks are absolutely necessary in everything we do outside. And I think that golf is an example of something where you can actually distance yourself because of the size of the golf course. And I would normally be in the woods anyway looking for my ball, so I'd be away from everybody if I was. But I think that those are two that seem to be on the right track. Anybody else want to jump in? Dr.
Farley, did you want to weigh in on that? I do not see Dr. Farley. I think we may have lost him. So Natasha, did you have a follow-up for the mayor on that?
No, that's fine. Thank you very much.
All right. When we get Dr. Farley back, we'll see if he wants to weigh in on that as well. For the moment, though, now let's go to Jack Tomzik of Metro.
Yes, this question about the masks. So I guess I was under the impression that they were required for people who were going, in places with other people like stores or even in, other crowded gatherings. But so are we supposed to wear a mask even if you're just going out by yourself and you're not encountering other people?
Well, Doc's not there, and Brian, I think, is still on. I mean, I put it on when I walk out the door. And I know there's lots of stores, grocery stores, who won't let you in. Reading Terminal Market and Acme and other places won't let you in the door with a mask. I think the sensible thing to do and the best thing for everybody and the safest thing is just wear it and get used to it. It's not that much of a burden. Just think about what nurses and doctors and hospital personnel have to go through every day, and just put on the damn mask.
Yeah. Just to follow up, Jack, retail establishments do require people to wear masks as soon as you walk in the door, to the mayor's point, and that is under the state's direction. So that is a requirement, and we are advising everyone to wear a mask as soon as they step out the door. Although that again is a strong advice, but that's how we're gonna flatten the curve some more.
And another question about the city layoffs among city workers. Are members of District Council 47 and 33, are they going to be included in that?
We're not at that point yet. We have to see how it goes going forward and what the effects of the economy are going to be through the summer. August is the date for additional layoffs. But Brian, do you have anything else to add?
I can say that we are certainly, all of our departments are looking at their operations, and it is certainly possible and probably likely that some members of DC 33 and DC 47 will be included, specifically on part-time and temporary workers.
Right, thank you. And one final question. It looks like Dr. Farley's back in the chat room.
Yeah, we need him.
My question was, what allowed you, Dr. Farley, to feel comfortable in making the decision to expand testing criteria?
Well, we're seeing an increase in the number of tests that are taking place, and we are having much less trouble purchasing the materials we need to collect tests. And the laboratories are telling us that they can handle a much bigger throughput than they could before. So all those numbers are looking good.
All right, thank you.
Thank you, Jack. And Dr. Farley, glad to see you back. The earlier question when you cut out was from Natasha Brown of CBS 3. The mayor weighed in on it, but we wanted to give you the chance regarding the issues of folks outside not wearing masks.
Yes, I mean, I think I addressed it before. I am concerned about people being outside not wearing masks. You know, if they're off there by themselves, they're not going to risk anybody else. But it's just easier to be in the habit of wearing a mask all the time. And then if you happen to come across somebody, it's safe. This is something we're all going to have to get used to doing. You know, I don't like wearing a mask either. I find them uncomfortable. On the other hand, if we all wear masks and we can reopen our economy, that's really worth it. You know, the country that I think that has handled this epidemic the best right now is South Korea. They've normalized wearing masks. People are wearing them all the time. And their economy is moving. And the epidemic has virtually disappeared there.
Very good. Thank you. And next up is Jason Peters of Philly Weekly.
Hey, first question. What has made access to tests easier?
I think what's happened is over time, just the companies that make the chemicals and the companies that make the swabs have been able to ramp up production. And that ramped up production has finally met the demand that's out there.
Okay, and one more question. With high unemployment numbers and continued quarantine leading into another month, is there any possibility or traction behind a rent freeze for the following month?
I don't know if we have the authority to freeze private sector rents. Certainly, we've been encouraging people to talk to their landlord to talk to their tenants, to talk to your mortgage company. Everyone knows what's going on to try to work out some type of deal where things can move forward. But I don't know if we even have the authority as a city, and we could certainly look at it, but I don't know if we have the authority as a city to freeze a private sector rental.
All right, that's all for me.
Thank you, Jason. Sean Walsh of the Inquirer, you're up next.
Thanks very much. A few of mine have been asked, but Mayor, since you announced the mindfulness initiative, I was curious, do you practice mindfulness or meditation?
I used to do yoga, but I got lazy. Yeah, I mean, it's hard. It's, you know, and I look at all the people who are working in not only in government, but out on the street as police and firefighters and EMTs and obviously the people in the hospitals. Yeah, I mean, you do your best to gather yourself every day and try to not overreact to things that are happening that are oftentimes out of your control. I mean, I miss seeing my mother, you know, up close and personal, being able to visit, you know, and that's part of the sadness, I guess, that people feel. But yeah, I do my best to stay straight and stay on course.
Thanks. And you mentioned DC 33 and 47 as far as the timing of when layoffs might be. Have layoffs begun within the administration or among exempt employees?
We're in that process now.
Has anybody been let go already?
Not to my knowledge.
There have been some communications, Sean, but official notices have not gone out, and the layoff date has not occurred yet.
I see. Okay, thanks very much.
All right, thank you, Sean. Perla Laura of Impacto, you're up.
Yeah.
Perla, go ahead. Perla, let me unmute you there. All right,
Okay.
try it.
Yes, sorry. I'm sorry. Sí, hemos visto que en diferentes lugares han habido pues incremento de problemas de salud mental. Ya es un problema también las adicciones en Filadelfia. Si tienen ustedes estadísticas al respecto y qué servicio específicamente han podido establecer para la comunidad que no tiene seguro médico, que no estaba acudiendo antes a ningún tipo de servicio de salud mental, en específico para las personas que no tienen, como les digo, documentos o servicios médicos.
Okay, gracias, Perla. The question has to deal with mental health and access to services. To address that, we've seen places that have shown an increase in mental health problems in addition to the addictions that have plagued Philadelphia from before. What are the statistics and the services that are available for the community that have no health insurance and have not been attending mental health services because they have no documents as well?
Let me just say, I don't have any statistics on that, but for anybody who needs mental health services, they can, in Philadelphia, they can call this number, 888-545-2600, 888-545-2600. That's the number for community behavioral health. And they can get support. You don't need health insurance for that. You can take care of people who don't have any health insurance.
Lo que le puedo decir es que no contamos con estadísticas en estos momentos sobre los servicios de salud mental en Filadelfia, pero sí le puedo dar un número de teléfono que es el 888-545-2600, el 888-545-2600, que es el Centro Comunitario de Salud Mental, que les puede proporcionar apoyo sin tomar en cuenta el estatus migratorio o el hecho que tengan o no seguro médico.
¿Habrá algún día que nos puedan dar estas estadísticas sobre el incremento, por ejemplo, del consumo del alcohol aquí en la ciudad o inclusive intentos de suicidio, llamadas para intentos de suicidio que hemos visto en otras ciudades también? Un incremento generalizado de crisis de ansiedad, etcétera.
Will there be a time when those statistics may be available? Maybe those about a rise in alcohol consumption or in suicide attempts or calls about suicide issues? Because we've seen an increase in those.
We'll have to get back to you on that. I don't have those numbers, and I'm not quite sure what's available to us.
Tendré que regresar a este tema más adelante porque en este momento no contamos con esas cifras.
Okay. Y solamente finalmente una sugerencia de que podrían hacer como campañas más grandes dentro de la comunidad, tanto hispana como no hispana, sobre la importancia de mantener la salud mental, porque eso también afecta mucho la salud física. Entonces, bueno, creo que eso ha faltado.
Just one suggestion rather than a question, to launch wider campaigns to outreach our communities, including the Spanish-speaking community, about the importance of mental health and the importance of mental health for physical health. That's what might be missing.
Okay, thank you.
Bien, gracias, Perla.
A ustedes, gracias.
Thank you.
Thank you, Perla. Next, we go to Claudia Lauer of the Associated Press.
I am wondering if there is any kind of, and I'm sorry that I missed the two updates over the weekend. It might have been previously discussed, so I apologize. Are there any kind of numbers for enforcement of social distancing over the weekend since the weather was so nice, or any kind of numbers about the new tickets or fines that have gone out?
Sure. So Claudia, we have a hard time tracking our real-time information on social distancing because our code violation notices are written under current guidelines, which is failure to disperse. And so providing real-time information is hard. I think generally speaking, I know officers and we have discouraged writing CVNs or those tickets in large part because we want people to take personal responsibility. Over the weekend, we did launch kind of a mobile billboard campaign to try and, again, reach people without having to strictly enforce and write those tickets. If we don't see improvement over the next week or so, we may we may change that tactic, but right now, I think we are really trying to issue warnings and provide guidance and to better educate our workforce, or I'm sorry, not our workforce, but the general population about what they should be doing and how they should stay socially distanced and wear masks.
Okay, thank you.
Thank you, Claudia. This is the final call for questions. If anyone has further questions, please raise your hand. But for now, we'll go to Pat Lowe.
Thanks. I'm going to go back to the layoffs. How many notices went out and to which offices?
So Pat, again, formal notices have not gone out.
Okay.
Some verbal conversations have begun, and that is really independent on the individual offices and how that's being handled by individual cabinet members. This is going to last for a while, those individual conversations. So we'll provide updated numbers when we can.
Okay, so you don't have a target number?
I don't have numbers on the initial layoffs. I only know what I'm personally involved in, which is why no conversation started.
Okay, thank you.
Yep.
Thank you, Pat. Denise Clay of the Sunday Sun.
If you do well on good afternoon, everyone. My question.
There are others.
I just walked out of the room. That's what happens when you share an office. My question is about the arts community and the cuts that were made to things regarding them. There's been a lot of talk. I think that's the cuts that have kind of like stimulated the most discussion, among the people I know. And the question that I've kind of been asked to ask is, did you have to cut so much from arts programs? And will that money be restored and the Arts for the Creative Economy Office be reconfigured if, the money comes in that allows the city to do that?
I mean, if we get back to normal before the pandemic started and we have the reserves that we have and we have the rainy day fund that we had and we have the pension reform improvements that we had, that would certainly be a topic for discussion. But at this point in time, I mean, we're talking $650 million. And while I recognize that the arts community is extremely important to the city, there are other priorities that we've had to look at relative to making the government work and continue to move forward to serve as many people as we can until we're back on our feet. So while I feel terrible, as I said in my budget address 2.0, while I feel terrible about all the stuff we have to do, it's just that we have to do it and we have to force ourselves to do it so we can recover.
Okay. Now, has any decision been made on Welcome America yet?
Probably something this week, early this week, maybe tomorrow, Wednesday.
Okay.
Anything else, Denise?
No, that's it.
Okay, very good. Thank you. And thank you, everyone. I see no further questions. So that concludes today's daily briefing. Thank you.